As a member of the ELC of the MAPS, I was very happy to join this because I felt that this was something different. This was an opportunity that was unlike others that I've came across in the past. And the reason was that this was built by people who are medical affairs professionals. It was not built by a company, it's not for profit, and their entire focus is on medical affairs. They don't look at other things, not MSLs, not CROs, none of the other types of professionals that we find in our industry. It was built solely for this purpose. And I think, when I think about comments that people have made during the last 2 days, they've talked about this feeling of being inside the family. So they could open up about the difficulties and the challenges they have and share in a way that was very open, very non-judgmental, non-hierarchical. There were no managers here and reports. In that sense, we were all sharing together our experiences in various stages of the development of our careers. Right, so that's a great question, and I've made that, I've had some discussions about this already with various members of MAPS. I think there are a number of issues. One is providers sort of, book, if you like. So some way that we can get information about providers and help people make choices when they need to look for solutions outside their company. A booth and a stand in MAPS is great, but we want to continue beyond the meeting. How do we get to people when they're looking, for solutions? So I think having some sort of tool where providers can engage with MAPS and with people who've heard about MAPS in a way that can contribute to their business would be great. That's one thing. The second thing is, I think, and I've talked about this. Obviously, this is an issue I feel strongly about. Is let's not keep this inside the U.S. Right? Let's make sure this is a global effort. There are a lot of medical affairs people all over the globe, in places we don't necessarily think about immediately, like Africa. It's growing there. It's still very small, but that's exactly the point when you want to lend a helping hand and tell these people there is this resource. We are here for you. We can help you grow in your territory on your own terms at your own speed. But we can support you, and I think that would be really important. And another thing that I have already suggested as well is to engage with other professional academic societies. One of the things I have suggested is the Royal Society of Medicine in the UK. They have various sections. They do not have a section on medical affairs or pharmaceutical medicine at all. And I think that would be a wonderful thing to start that dialogue. And there are many other professional societies that I think we can engage with. The American Psychiatric Association, ASCO, so many, too many to list, but I think we should try to explore some collaborations with other professional societies.